Tier Level 1 provides basic things that patients would want around their surgery to make their surgical experience easier. It includes CBD products. CBD is essential for sleep and pain relief after surgery. Helps lower patients' need for opioids. I find it very essential. Patients are very, very happy with it. Another thing that I provide in Tier 1 is a 0-degree knee device, which is a device that will help with knee replacement patients to help them passively regain their extension after surgery. So it holds them in a position where they can passively get extension on the knee without having to do any exercises to do it. They also find comfort in sleeping with it at night. Nutritional products. Nutrition is incredibly important after surgery. Decreases inflammation, improves healing. So I've provided a nutritional supplement for 2 weeks around the surgery that patients can take to improve their nutritional status, specifically focused on surgical recovery. I also provide telemedicine, so if patients want to get in touch with me or my physician assistant very quickly, we can do telemedicine appointments that day with those particular patients. I've also provided an ice machine. Many patients, despite me giving them a recipe for an ice bag, say, you know what, my friend had this ice machine, it circulates the ice, I really want that. So I went and found one, got that for those patients. Another device that I got that's a safety device is a mobile Venego DVT prevention device, which is basically these cuffs that go around the calf that squeeze, that will help circulate the blood when the patient is sitting, lying down, things like that. That will help improve the circulation in the leg, keep things flowing, lessen the risk for DVT. Also included in Tier 1 is the navigation planning fee that we charge for all of our patients. Tier 2 includes everything in Tier 1. It also includes additional features. Tier Level 2 gets you no office wait times. When you come to the office, we know you're coming. You're not gonna have to wait, you're the next patient seen. Your appointments are always with me. Another thing that patients get is my direct cell phone. So some patients just wanna know that I'm on call for them. So did surgery last week. I was in the middle of calling my patients that I did surgery that day on and making sure they're okay. And this guy calls me and I said, hey, so Mr. So-and-so, I was about to call you. And he says, well, I called you first. I said, well, is there anything I can do for you? He's like, nope, I was just making sure you'd pick up. So some patients just want to know you're there. I also have a protection plan for patients. So when you go to the iPhone store and you get an iPhone, it comes with a protection plan. Now you can have a protection plan for your surgery. So if there's an issue within 2 years of your knee or hip replacement, that complication would be covered. Now it's not a guarantee that you won't get a complication, but if you should unfortunately have one, it would be covered under this protection plan. Another benefit that's quite important to some patients is I've set another scheduling algorithm for patients that are in Tier 2 and Tier 3, where I will adjust to their schedule. The final thing in Tier 2 that I've added is a walker. It's just a simple walker, which I make everybody do for the first 2 weeks. They have to use a walker, and so I provide a walker for those patients. Tier 3 is kind of the ultimate package. It includes everything in Tier 1, everything in Tier 2, and then I've gone out and found if I was experiencing a knee or a hip replacement, what are the absolute things that would just be over the top, and that's what Tier 3 is designed for. Again, not for everybody, but some people might want this. I found one device in Australia from an Australian surgeon that's called a Maxim Skate. This is a device that will attach to a patient's knee after a knee replacement and attach to their foot, and where they can manually move their knee back and forth. So it's like a passive motion machine, but the patient controls it. It also has an app with it so that it will sort of watch what the patient's improvement and goals are with regard to range of motion and assist them in their postoperative recovery. Patients don't want to cook after surgery, so they can either meal prep before. Sometimes it's nice to have somebody come in and bring meals to you. So I've provided 2 meals for 2 weeks for 2 people. Some patients just want to have a meal service, and that's completely okay. Patients may want to have a more objective analysis of what happens to their gait pre and post-op, and for those patients I've arranged to do a gait analysis for them, both preoperative, 3 months post-op, 6 months post-op, and at 1 year. And so I've bought a gait analysis device that we can put patients on, and then we can see objectively how they improve over the first year. So I've also added 6 sessions on the slipstream. A slipstream is a air pneumatic lymphatic massage, which physically and forcibly removes swelling and edema out of the limb. Patients love it. They have decreased pain, decreased visual analog scale, and increased improvement in their function immediately after this. It's a game-changing device. Some patients, they decide that they do not want to go upstairs and sleep. They can't make it upstairs where their bedroom is to sleep after their surgery, and so they want to sleep downstairs and they want to sleep in a recliner. So I've added a recliner rental for 2 weeks for these patients while they're in that perioperative period and getting themselves mobilized. Some patients, they would love a recliner. I got it for them in tier level 3. And then finally, for patients in tier level 3, I offer them a game-ready ice compression device. This is the device that many professional athletes use that provides a cold-powered coil that was literally designed by NASA scientists and offer compression, so it combines both the cold and compression to try to rid the leg of swelling and pain. Very helpful. A lot of professional athletes use them. Patients really like it. No matter what pathway you've chosen, I'm honored that you've chosen me to be your surgeon and go on this journey with you. It's been an honor to do this for the last 25 years, replace 11,500 joint replacements. It never gets old. I have the best job in the world. Seeing people restored to mobility, to improvement from pain, to a lifestyle that they want to have or get back that they lost. I'm super happy you're joining me on your journey.